It's the second day of a 4-day strike by junior doctors who are asking for a 35% pay increase, they say, to compensate for 15 years of below-inflation wage rises. The government says it's unreasonable. Thomas McGill sent us this report from the picket line outside Lewisham Hospital.
Well, it's day 2 of the industrial action by junior doctors down here at Lewisham Hospital, and yet again a good selection of doctors who work down here at Lewisham Hospital have turned out to make their voice heard, and by the sounds of the number of cars that have been tooting as they've driven past, there seems to be some support as well for these junior doctors. And actually, Gillian here as well is not a junior doctor, but you've turned out to support their cause. Why is that, Gillian?
Absolutely. Because I think this, first of all, I'm part of the Lewisham Save Our NHS campaign. Now our hospital is being jeopardised because so many staff are leaving the service and even leaving the country. And when I looked into it further, what I discovered was I earn more than a junior doctor and I'm just a tour guide. And I know that, especially look at me, you know, at the age that I'm at, I think I might be needing there to be a health service, and there can't be a health service without junior doctors.
Gillian, thank you so much for speaking to us today. Well, obviously, if these junior doctors are not in work today, some operations and appointments are either being cancelled or postponed. But earlier I spoke to a consultant here who said that he's in today doing some of the work that these guys would normally be doing.
I think there will inevitably be appointments cancelled, there'll be operations cancelled, so, you know, it will undoubtedly have an impact. I appreciate the public will feel that junior doctors are well paid in comparison to most, but their pay has been eroded. In the short term, there will inevitably be issues around patient care. I think, as the junior doctors are saying, in the longer term, this is in the interests of a better health service.
Well, the strike is expected to last until Saturday, and the Health Secretary, Stephen Barclay, says that he will not negotiate until the BMA changes its position, its starting position, where they're calling for an increase of 35% to junior doctors' pay. Thomas McGill, BBC London.